It was just your birthday. The best day you were planning to enjoy with your friends. Suddenly you have a swelling on your side and you have a pain very bad on your side of your ear, your side of your mouth, and you went, ow. And then you remembered the dentist saying that there was a small filling to be done in your back teeth 6 months back. Then you rush back to your dentist, somehow get it done for your party. And the dentist is helpless most of the time because he might be very busy with some other dentist. But we have come up with what is called a single visit root canal therapy. You can do it within 40 minutes that you will come out of pain and swelling, and the treatment is done just in 40 minutes. I'd like to tell you that this is what is joyful. Even if you forget, first of all, I'd like to tell you, don't forget the dentist's advice. If it is a filling, please do it. If it is a small filling also, you please do it within the time told by the dentist. If you have delayed it, never panic. You can just barge it to a root canal therapist or an endodontist who does single visit rotary endodontics, wherein he can do a miracle on your tooth. He can remove the pain, he can remove the infection using laser, you can use the ozone, you can use rotary instruments which takes out the pain, which takes out the neural tissues and all the infection, and give you a totally pain-free tooth within 40 minutes. This is what I'd like to tell you about single visit rotary endodontics. Why and how is it done? Why it was done in multi-visits? Before, what we used to do is we used to use chemical agents and hand instruments to go into your teeth. So we have to use our hand and go into your teeth and take out manually. You know how difficult it is to put a small instrument which is handheld into a small orifice of less than 1 millimeter in size. We didn't have enough instruments to see into the tooth. So now we have microscopic dentistry. We can see it as big as it's almost 1 feet as we see in through the microscope. So it is much more easy to see the canal, first of all. Second thing is we have rotary instruments or mechanical instruments which is electronically operated. So what happens is we don't have to use our fingers to slowly drill it in. So it takes the dentist a lot of time to do that. So this is much more easier. You just put your endodontic motor on and just go in. It will slowly go inside. Now, and moreover, it used to take 15 minutes to take an X-ray. Now we don't use an X-ray, we use a digital radiovisuography, wherein you just click it, 3 seconds, we have the image on the computer. So we will definitely know where exactly our files are going. So, and it is much more radiation free. So we are not bothered about how many number of X-rays we take. We might take up to 5 or 6 X-rays to do a root canal treatment. So it is much more precise. We are seeing it. From top we are using a microscope to see. From inside where it goes and reaches, we are using a digital radiovisuography so that we can reach the tip of the tooth and take out the infection right from the tip of the root. So you will have a good filling also done using the best technology. And if there is an infection which is even bigger, we can use a laser. We can take the laser down to the tip of the root and we can kill all the germs there. We can also remove all the infectious tissues. And laser is so comfortable that it doesn't even touch the surrounding tissues. It takes first the granulation tissue or the infected tissue. So you might think that laser is injurious, but the soft tissue lasers which we use is absolutely not at all injurious. So what happens is you just go through the orifice. We have already widened it using a rotary instrument. You just go inside and then kill all the germs there, because the laser kills all the germs. Second thing, you go inside, take out all the granulation tissue only, because if it is kept for a very long time, yes, I do agree that it can hurt the surrounding tissues, but we use it in pulses, we use it in microseconds. So you just go there, shine it, and all this germs and all this granulation tissues goes in seconds. And second thing what we use is an ozone, wherein you generate ozone inside there so that it will be much more clean. And so even if you are a diabetic, you will not have enough response from the body. So what we use is use an ozone, so that we clear off all the microbes inside, that all these problems are solved without an antibiotic. Most of the time, otherwise we will have to give an antibiotic. Without any antibiotic we can do it, or even if in diabetes, ozone can assist in getting all the microbial contamination to a very low extent. So all this technology has made the root canal treatment a painless treatment, moreover a single visit treatment. So multi-visited is all over. And second thing what you have to do is, after a root canal treatment, you need to put a crown. Even that can be done in one sitting. You can just do the crown preparation also on the same day of the root canal treatment, saving a lot of time. So even if you have forgotten and done some mischief with your tooth, you can just walk in and get that root canal treatment done in just 40 minutes. So you don't think that root canal treatment is a painful procedure, and never think about taking out a natural tooth, because that is going to hurt the opposing tooth, the neighboring tooth. So please don't think about extractions. Think about root canal treatment. It's absolutely pain free and it's absolutely amazing. You yourself can see the fillings done till the tip. You ask your dentist, he'll explain you exactly what can be done on your tooth. Thank you very much.